is your stem?
Okay, ma'am.
All right, so if you've read and understood, considering a critical care scenario, please tell me, how would you manage this patient now?
Considering the scenario,
Yes,
I will manage the patient according to the care of critical ill patient management protocol.
yes,
And I will repeat, check the airway and breathing, then give my attention towards the circulation. Here's the patient is on shock status.
yes,
So I will give insert to wide bore canal and insert the saline crystalloid fluid and draw the blood for total blood count, blood grouping, cross-matching, electrolytes, creatinine, ABG.
okay,
And I also give the oxygen to the patient.
yes, and
Urinary catheter, insert the
okay,
urinary
and
catheter.
considering the complaint of the
Once,
patient.
yes, and I'll think my diagnosis about that maybe the case of rupture abdominal aortic aneurysm, the patient, and arrange the blood.
What is the difference between aortic rupture and aortic dissection?
Aortic dissection is the rupture only the tunica intima.
Okay, and what about aortic rupture? What is
Rupture,
that?
it may be the whole of the wall of the vessels may be rupture.
Okay, that could even be traumatic, but here we
Yes.
don't have any history of trauma
No,
in the
no,
patient,
yes,
especially, right? The pain
yes,
has started suddenly and severely.
yes.
So, all right, if I ask you to define or classify aortic dissection, how would you classify it?
Okay, yeah, it may be the according to the involvement of the wall, if true and false. If
Okay,
all
right,
if
yes.
all layer is involved, that is the true. If the single layer or the fibrous tissue is only, then it's a false aneurysm dissection.
This is one
According,
type of classification. Another,
yes, morphological, it's
okay,
maybe the secular fusiform.
okay.
Another is the etiological classification, that is the atherosclerotic, mycotic, collagenous, and the
Yes.
traumatic.
Okay, good. Could there be any other classification, type of classification, maybe on the presence because of the
Infrarenal, suprarenal.
site? Yes. Okay, good.
Majority is the infrarenal,
Right.
95%.
Yes. How should a patient who you suspect can have aortic dissection be managed or followed up? Managed and followed up, not all.
Okay, if the patient having the sudden severe abdominal or back pain, pulsatile mass, and hypotension, I will consider the patient is on case of abdominal aortic rupture, and I'll do the investigation CT scan for confirmation my diagnosis. And for the management purpose, I give full attention to the operation, not for the resuscitation the patient. Operation is the prime management here.
Okay, all right, okay, operation. But when you were telling me about the management, you have not mentioned anything
Yes,
about
I'll do investigation CT scan.
you'll do CT scan. Is it
Yes,
the,
ma'am.
okay, uh, is it the most gold standard
And
management procedure or imaging?
angiogram,
Okay, angiogram is the
CT
gold standard.
angiogram,
Is it the gold standard? Is it something we should do it right away? Easy to be done?
duplex.
Yes. Yes. That is more okay. Well, if just suppose you don't get to manage this patient on time, What are the complications that you should be aware of?
Yes, it may be the rupture.
Okay, and
It may be the rupture. The patient
just
will
suppose it
press.
does not rupture, because from the beginning you're saying aortic rupture, but I want you to consider aortic dissection instead, because if there is aortic rupture, patient would die,
Yes, yes,
right?
ma'am.
Patient would not
Yes.
be lying with blood
Not
pressure
reach
70,
the
40.
hospital.
So no, never. So if this is aortic dissection and you cannot manage the patient on time, one is it can rupture, patient can die.
Rupture.
What are the other complications that can occur? There could be thrombosis.
Yes, thrombosis.
Okay. There could even be embolism. There could
Yes.
even be formation of fistulation to the bowel or to the vena
Yes,
cava
yes.
or to
Yes.
the renal vessels. There could
Then
even be,
hematemesis melon.
all right, yes. And there could even be because of the pressure effects.
So
See,
intestinal
secular.
obstruction may develop. Yes.
When it is secular form of aortic dissection, what's it's doing? It's exerting pressure on the adjacent organs. So what's
Yes,
happening?
ma'am.
Adjacent organs are also being affected. All right,
Yes.
just suppose you've taken this elderly man in the theater and you have managed operatively or invasively. What are the most common post-operative complications that can occur?
Okay, ma'am. There are lots of complication like the migration of the mesh, endo leak, then the acute coronary failure, acute renal failure, the continued bleeding, organ failure, others organ failure, limb ischemia, bowel ischemia,
Okay,
spinal cord ischemia,
these are the
stroke.
surgical associated complications. What are the medical associated complications
Yes,
that can
acute
occur?
renal failure, acute congestive cardiac failure.
Right, good. Okay, just suppose you think there is aortic dissection and you want to manage it. You want to stop the blood vessel bleeding. How would you do it? After you have like transferred the patient and you still suspect, okay, that there is still some bleeding going on, you couldn't just stop it. What would you do?
Yes, endovascular repair of the aneurysm, endovascular repair for that remove the aneurysmal part and the repair of the
You've done that.
remaining portion.
You've done that. Now we are discussing post-operative complications, right? So post-operatively, you suspect that once you have anastomosed or you've repaired the dissection, there has been left some bleeding, some vessel, some part of the vessel, which is still bleeding, or anastomosis has
Yes,
been
yes, ma'am, I
undone.
got.
Yes,
Yes,
what would you do?
I will give the whole blood or maybe the fresh frozen plasma, platelet, cryoprecipitate,
Yes,
and the
this was my
tranexamic
question.
acid.
Yes, this was my question. Okay, what else can you give in order to maintain the mechanism of hemostasis?
Yes, the vascular contraction. The smooth muscle wall will be contracted by local reflex by serotonin from the release from the platelet and thromboxane A2. The
Yes,
platelet activation, that is the adhesion, aggregation, and plaque formation, and the coagulation system, intrinsic, extrinsic pathway, formation of fibrin
good,
clot.
good. Yes. Okay. Last question. Bell has gone, but you took so long. So please tell me, what are the risk factors which can lead to aortic dissection?
Okay, the smoking, diabetic patient, hypertensive patient, the traumatic, atherosclerotic.
Yes, good. Good. Thank you.
Thank you, ma'am.